if you see these anti-cancer drugs, let me tell you how they were developed and what was the basis for their development. So anti-cancer drugs, right, anti-cancer drugs, remember they were developed based on, right, they were developed based on what is called as murine L1210 leukemia model, right. This is a multiple choice question here, right. They were developed based on murine L1210 leukemia model, right. This is a multiple choice question here. Now next point, if you see here, this model, that is murine L12 leukemia model, this model has a growth fraction of 100%. Alright, this model, they have the growth fraction of 100%. What does that mean? That means this model has a growth fraction of 100%, that is all cells are actively dividing cells. So if you take this model has a growth fraction of 100%. So what does that mean? That is all the cells, right, all the cells, they are actively dividing cells. Right, all the cells, they are actively dividing cells. Okay. Now what does that mean? That means that this particular anti-cancer drugs were based on, or they have been formulated based on the drugs which were acting on the actively dividing cells. So how they were, all these anti-cancer drugs were developed is, they have seen that this particular anti-cancer drugs, they have to be acting on the actively dividing cells. Now once the anti-cancer drugs act on the actively dividing cells, and once they stop their active division, they were being formulated as the anti-cancer drugs. Now if you see here, based on this murine model, that is murine L1210 leukemia model, based on this murine model, cytotoxic drugs act with first order kinetics. Okay, cytotoxic drugs, they act on the first order kinetics. Alright, what does that mean? That means that a constant proportion of cells are killed with a given dose rather than constant number of cells. Okay, so first order kinetics in the sense, constant fraction of cells, right, constant fraction of cells are being killed, then, right, then constant number of cells. Is that clear? Now I'll tell you for an example. So the antineoplastic drugs, they follow the first order kinetics, where they kill the constant fraction of cells rather than constant number of cells. Now let me tell you, they follow a hypothesis which is called as lock-kill hypothesis. So these drugs, they follow what is called as lock-kill hypothesis. Now let me tell you what do you mean by this lock-kill hypothesis. For example, right, for example, you take a dose of the drug, right, you take the dose of the drug. For example, same dose of a drug will be required to reduce the tumor population from 1000 to 100 as is needed to reduce it from 100 to 10, right. So they follow what is called as lock-kill hypothesis. What does that mean? A constant fraction of the cells are being killed. So for example, the same dose of a drug, right, the same dose of the drug is required same dose of the drug is required to reduce the tumor population from 1000 to 100 as is needed to reduce, right, as is needed to reduce from 100 to 10. That is what is called as the log-kill hypothesis. Whereas you take this particular hypothesis, this will not be followed by human solid tumors. Human solid tumors, they follow a model which is called as Gompertzian model. Right? The human solid tumors, they follow what is called as Gompertzian model. I'll tell you what is this Gompertzian model. So the human solid tumors, right, human solid tumors, remember they follow what is called Gompertzian model. Now what does that mean? I'll tell you. So human solid tumors do not follow the log-kill hypothesis, they follow the Gompertzian model. Why? Because the growth fraction of the human solid tumors is not constant but decreases exponentially with time, right? So they do not follow the log-kill hypothesis because the human solid tumor, right, human solid tumor, growth fraction of the tumor, right, growth fraction of the tumor is not constant, right, growth fraction of the tumor is not constant but decreases exponentially with time, right, but decreases exponentially with time. Now you take this growth fraction. Remember, growth fraction peaks when tumor is approximately 37% of its maximum size. Okay, so growth fraction of the tumor, right, growth fraction of the tumor, it peaks when tumor is approximately 37% of its maximum size, and this model is known as Gompertzian model. I'll repeat again. Gompertzian model is followed by the human solid tumors. Human solid tumors, they do not follow the log-kill hypothesis. Why? Because the human solid tumors, the growth fraction of the tumor is not constant but decreases exponentially with time. What decreases exponentially with time? Growth fraction decreases exponentially with time. So when does the growth fraction peaks? Growth fraction peaks when the tumor is approximately 37% of its maximum size, and this model is known as the Gompertzian model. So this is about the antineoplastic drugs following the first order kinetics, right? One is based on the log-kill hypothesis and the other one is the Gompertzian model. Now let me tell you what are the various classes of the antineoplastic drugs.